I'm Anusuya Supaya Chia, and I'm a breast cancer survivor.
Hi, I'm Siti Zaliha. I'm a breast cancer survivor.
Hi, my name is Branda Lai, and I'm a breast cancer survivor.
What happened is my husband and I discovered there was a nipple discharge, a clear liquid, and there was pain in my right breast. And so my husband said, hey, you better go and check it out. And when I went to my gynecologist, okay, first he was checking me, and then I said, Doc, a liquid came out from my nipple and there was a sharp pain on my right breast. Oh, he said, it's just active mammary glands. So I said, oh, okay, then nothing to worry about. He said, no, nothing to worry about. So I said, Doc, I'm going away for about 6 months at least. I think I should go for mammogram. He said, no need to go for mammogram. I said, Doc, I'm 44 years old. Can you please let me go and do a mammogram before I go? And actually, this was prompted by my aunt who had gone through breast cancer, and she knew I was going away for a while. So she thought I should do this mammogram before I go away.
It was actually on the third week of Hari Raya. One evening at about almost midnight, I felt pricking sensation on my left breast, and when I touched it, at first I didn't feel anything. It happens again on the second day, and then again I had that sensation. And this time when I pressed it, or when I feel hard, I could actually feel there's a lump. And that's where I decided to see my company's doctor for a checkup.
I suspected something was wrong when one day my husband, who was still my boyfriend, then told me that he felt a lump in my right breast, a small one, a very tiny one. I didn't really think too much because I thought, I'm so young, how could anything bad happen to me? But my boyfriend insisted that I should get it checked. Well, I brushed him off, telling him that, it's probably nothing, because nobody gets cancer at the age of 27. So I didn't get it checked, of course. Waited for 6 months until December 2014 when I decided to do a self-check in the shower. And to my horror, the tiny lump has grown significantly. I thought maybe I really should go and see a doctor and get it checked.
Breast cancer is the commonest cause of cancer among women, both worldwide and in Singapore, and it is also the #1 cause of cancer deaths among women. In Singapore, about 1,800 women are diagnosed with breast cancer every year. The most common presentation of breast cancer is a painless hard lump in the breast. Other presentations include skin changes, for example, skin redness, swelling, puckering, dimpling of the skin, or even skin ulceration. It can also present as a nipple discharge or a change in the symmetry or shape of the breast. Breast cancer is predominantly a female cancer, so all women are at risk, and this risk increases with age. Women with a family history of breast cancer or women who carry a genetic mutation like BRCA mutation will be at higher risk of breast cancer. Those with longer estrogen exposure in their lifetime, for example, women who start their menses early, before 12 years old, or go into menopause late after 55 years old, or women who have not had children or had not breastfed, these women are at a higher risk as well. Some women take hormonal replacement therapy after menopause, and taking prolonged hormonal replacement therapy after menopause may also put the woman at a higher risk of breast cancer. Lifestyle factors can also change your breast cancer risk, and studies have shown that obesity, physical inactivity, alcohol, and smoking can all increase breast cancer risk.
I came back about 4 months later, and then my cousin, he hounded me to go with him to see the breast surgeon of his mom, because he says, no, you have to analyze the results with the breast surgeon. Then 1 week after my birthday, a Saturday, I went to see the breast surgeon, and he took the results and he said, let me examine you. He examined me, he pressed my breast, and the liquid shot out and the pain was there. And he said, what's this? I said, oh, doc, nothing. It happened a few months back, but my gynae said it's nothing. And I told him the same thing. And he said, what? I cannot believe this. Let me do a biopsy. So, needle extraction of the liquid and the tissue. He said, just wait for the results, it will be out on Monday. So the nurse called me on Monday. She said, come back on Tuesday. I said, why must I go back? She said, no, doctor said he wants to see you. So I said, okay. So I knew it was already must not be good news.
After my mammogram, I was referred to the GP, and after that she referred me to a breast specialist. So I went, and then the specialist, the breast surgeon, actually did several tests like CT scan, and then she found out that there was a lump, and she said it was quite suspicious. So she decided to do some biopsy. 5 days after the biopsy, the result came out. I went to see the doctor, and then of course I was given a letter, and then I was actually confirmed having cancer stage 2.
I actually went to see a doctor on my own. I went to see a gynae because at that time I didn't know which doctor to go to. So I went to see my gynae, had a gynae checkup, and at the same time I told him that I felt a lump in my right breast. And he said, don't worry so much, you're young, it's probably benign, why don't you just do an ultrasound scan? So he referred me to do an ultrasound scan, which was inconclusive. So I went on and did a mammogram, which was inconclusive as well. So in the end, through recommendation of one of my colleagues, I went to see a breast surgeon, and he looked at my ultrasound scan and mammogram result, and he said the best thing to do right now is to do a core needle biopsy, which I did. The result came back. They confirmed that I had breast cancer.
When a woman comes in with a newly discovered lump in her breast, she will require a clinical breast examination by her doctor, which includes asking her questions about her symptoms as well as her risk factors for breast cancer. She will then need further tests if this breast lump is confirmed, and the tests will include a mammogram, an ultrasound, or both. If the mammogram or ultrasound shows suspicious breast lumps or an indeterminate breast lump, she will then require a biopsy for this. There are different ways of doing a biopsy, and the choice depends on the size and location of the abnormal area, as well as whether this area can be seen under an X-ray or ultrasound. The most commonly performed biopsies are core needle biopsies and vacuum-assisted biopsies. First, we will localize the area under X-ray or ultrasound, and then numb that area with a local anesthetic. Then we will make a nick in the skin and put our needle in to extract several samples of the breast tissue for further testing.
During the first few days after my diagnosis, before I began treatment, I was at the stage where I think most people who were diagnosed with cancer experience. I was in denial, and then I was angry, then I was depressed. I think finally I tried to accept the truth that I have cancer, and I tried to stay positive. I talked to my boyfriend, and my boyfriend told me that you are a very strong girl, you're very tough, you would pull through this. I was kind of actually looking forward to starting this battle.
Thank goodness that my church pastor at that time has a brother who was a gynae, and so he called me just a day before I went for surgery. He said, "You're in very good hands. Just do what your heart says. If you think you want to go for mastectomy, go ahead and do it. And I know this doctor is an excellent doctor. Be positive." My mother says, "You're the brave one in the family, so I'm not scared for you." So she said, "You'll be all right." And yeah, I was all right.
Chemotherapy is one of the modalities used after surgery to decrease the chance of breast cancer recurrence. Not all women need chemotherapy. The decision for chemotherapy depends on the health status of the patient, the tumor characteristics, and stage. In recent years, we have used chemotherapy before the surgery to downsize the tumor so that the patient can undergo breast-conserving surgery instead of a mastectomy. A mastectomy is required when the patient is not a suitable candidate for breast-conserving surgery. For example, if she's got multiple tumors in different areas of the breast, or if she's got a large tumor to breast size ratio. There are many methods of breast reconstruction after a mastectomy, of which the commonest will be an implant reconstruction. Other methods will be using a tissue flap from the back of the patient or from the abdomen or thigh. About 10 to 30% of women in Singapore will choose to have breast reconstruction after a mastectomy. Breast reconstruction allows the patient to feel whole again after breast cancer treatment.
So I was referred to go for a second opinion, and then the same test was done on me, and that's where I found out that, okay, this is a confirmed cancer, and that's where I decided to go for mastectomy. On the 15th of August 2013, that was actually my operation date. So I asked the doctor, or asked my breast surgeon first, what will be the outcome or what will be the result after the operation. And then she told me that normally it's not that painful, of course, because we are on anesthetic, and yet the only thing that I would feel is tightness. And yeah, so after 8 hours, I woke up and all I felt was tightness. The next challenging stage was the chemotherapy. Of course, my breast specialist sent me to the oncologist to get some advice or all the details for the chemo. And obviously, the first thing that comes to my mind is, will I be sick? Will I fall sick? Will I be weak? Will I get bald?
Well, unlike most of the breast cancer patients, I didn't have surgery first because of the location of my lump, which was right behind my nipple. My breast surgeon told me that it would be better if I go for chemo first and then surgery, because if I were to go for surgery at that point, he would have no choice but to perform a mastectomy. And he said that it would be a gamble to go for chemo first to see if your lump would shrink small enough for me to perform a lumpectomy instead. And I told him that, yeah, sure, why not? Because I would have to go, no matter what, I would have to go through chemo anyway, so why not? Even if it's 50-50, I would give it a shot. So I began my treatment with 4 cycles of chemotherapy. The first cycle of chemo was quite painful because maybe my body was in shock or something. So the first few days was okay. I didn't really feel much until I think the 5th day when I started to have body ache, bone ache, slight fever. And the worst side effect that I had during the first cycle was boils on my body. I couldn't sleep, couldn't sit. It was so painful. I went to see my oncologist. He gave me some antibiotics, but it didn't really help much. So eventually my boyfriend had to drain it for me, and the process was really painful, but I'm glad that after the drainage I could finally sit. Other than that, I just felt weak and fatigued, which were bearable. I'm sure people who are going through cancer, they need a lot of support from their loved ones. And I'm very lucky that I have a very, very supportive family. But they all try to make time for me. Even if they can't physically be here with me, they send me messages, they call me every now and then. My mum flew over to take care of me. Of course, another person that I really have to thank during my journey through cancer is my husband. He has been nothing but supportive. After I was diagnosed, he actually proposed to me, and he told me that it wasn't out of pity. It's just that he really wanted to show me that he would go through thick and thin with me. After knowing that I have to go for chemo, I asked my oncologist, will I lose my hair? He said, yes, definitely. So one night before chemo, my first chemo, I decided to shave my head because I didn't want to see my hair fall. So I told my fiance, I'm just gonna shave my long hair off. And he said that, are you sure you want to do that? I said, yes, I am going to do that. And he said, okay, I'm gonna do it for you. So that night, he just sat me down and we started shaving. We took a picture of it.
One of the physical changes that I had to go through is losing my hair. So that is something that I must say was very, very difficult for me. I used to go to the salon and set my hair, and it's always set, you know. And the first things first one of the first few questions that I asked the doctor, when will I lose my hair? So he told me that after the first round of chemo, he told me that, Zaleha, you're going to be completely gone by next Friday. So can you imagine how would I feel? So on Monday morning, I started to feel something is not right on my head. You know, you start to feel that kind of, I had that kind of feeling on my, it's like the, what do you call it, the pores or whatever started to open up, you know. And then in the evening, I started to rub, and then I could see slowly that the hair started to come out, and that's why I started to tell my husband, I said, hey, my hair is going to be gone, you know. So I told my husband, okay, I tell you what, tomorrow I'm going to go to my salon and have it botak.